Most mothers are not only deficient, but actually the safe amount that pregnant and breastfeeding women can take is much higher than the recommended. So I would really encourage you to kind of take a look at some of her work. But instead of, say, the 400 IUs that are kind of the recommended daily allowance, she's talking about in the neighborhood of 1,200, 1,600. And she's done a bunch of studies to demonstrate, yeah, that amount is actually safe. So you want to go within reasonable parameters. But chances are, if you've got a mom who's showing kind of depressive symptoms, she actually might be vitamin D deficient. Hey, everyone, welcome back. This is the Science Chick Report, and I'm Dr. Kathy Kendall-Tackett. So I'm going to continue on in our series talking a little bit about what are some things that can be done kind of at the community level that mothers can do on an individual basis that can help. And that's one thing I kind of want to just talk to you about. And again, it's not that you're going to oftentimes tell mothers to do this, but you can say that research definitely supports. And sometimes what I do is I would honestly recommend that mothers talk to their primary care physicians and let them kind of know what kinds of things they're going to do. But for the most part, most of this stuff is actually really straightforward, and there's really no harm with it. Unless you take absolutely excessive amounts. For the most part, it's safe, but it's just a good idea because when you start talking about things like supplements and stuff, they can interact with other medications, and I just think it's good to kinda get especially if mothers are taking other medications, we wanna make sure that they, are doing something that is safe. Okay, so the next one up, I'm gonna talk about, and, this is gonna be kind of a focus on other things that mothers can take that can be helpful. We're gonna talk about vitamin D. Now, this is actually really kind of an interesting one because, again, we have sort of rampant problems with vitamin D deficiency all over the world. Partly because we live our lives inside, partly because we've taken a lot of measures, prudent measures, honestly, to actually not get skin cancer. Okay. But, oftentimes these sort of public health initiatives tend to have an unexpected consequence. And the unexpected consequence in this case was that we were having problems with vitamin D deficiency. Okay. And it first actually showed up, where we first started really seeing it was with a group of low income African American mothers in North Carolina. Okay. And so that's actually the first group that really kind of highlighted that. And, you find too that African American mothers in particular seem to actually have an issue with this because it has to do with sun exposure. And, this process, you need sun to actually manufacture vitamin D in your body. And if you've got a lot of melanin in your skin, that process is kind of blocked or it's harder. So that was the first group, but it's been true for everybody. It's even true rampantly all across Australia, which, if you've ever been there, very, very, very sunny place. So it seems like a very unlikely place where you'd have a lot of vitamin D deficiency, but you do because everybody, covers up and puts on sunblock. And, that's just kind of the way it is. But, this is something that is fortunately very easy to address. Now, people get kind of nervous about vitamin D because they think, okay, well, that's a fat soluble vitamin. You can take too much of this. Yes, you absolutely can. But what Carol Wagner and her colleagues at the Medical University of South Carolina discovered is that most mothers are not only deficient, but actually the safe amount that, pregnant and breastfeeding women can take is much higher than the recommended. So I would really encourage you to kind of take a look at some of her work. But instead of, say, the 400 IUs that are kind of the recommended daily allowance, she's talking about in the neighborhood of 1,200, 1,600. And she's done a bunch of studies to demonstrate, yeah, that amount is actually safe. So you want to go within reasonable parameters. But, chances are, if you've got a mom who's showing kind of depressive symptoms, she actually might be vitamin D deficient. Okay, so vitamin D, if you're deficient in it, one of the things that it does is it increases inflammation. Okay, so that's actually, again, when you've got inflammation, you've got depression. So depression is just one of the physical problems related to it, but also, the whole host of other anti-inflammatory, or inflammatory illnesses like metabolic syndrome, diabetes, cancer, all these things are related. Heart disease, you name it, they're all related to inflammation. But, so vitamin D deficiency is kind of bad all around. And again, pretty easily addressed. Okay, so I think one of the kind of most compelling studies that looked at this in terms of depression was actually done in China. They had 1,773 moms. Okay, and it was Wang et al. 2023. So this has become of interest kind of outside the US recently. We're starting to get a lot of studies from other parts of the world showing this is a problem. Okay, so they found about 27% of their mothers were deficient. Okay, and if they were deficient, they were 70% more likely to have depressive symptoms on the Edinburgh Postnatal Depression Scale. Okay, and so the inverse was, or what they found is kind of that there was this inverse relationship between vitamin D and score on the Edinburgh. Okay, so like the higher your vitamin D, the lower your Edinburgh score. Okay, which means lower depressive symptoms. And so they actually were able to sort of track it in kind of a linear way. But they did find that one group, the 27%, were much more likely to have depressive symptoms. So again, pretty straightforward fix. And will it fix every single problem in their mom's lives? Probably not, but it gives them at least a good base to start to get better. And I just think it's better for their health in general. Okay, now another study was a Beanie et al. In 2019. They did a review of 7 studies, and they found that vitamin D was related to incidence of depression, and they felt it was critical in recovery. So addressing the vitamin D deficiency. So again, pretty straightforward fix. I think that that's a good idea in general. Okay, so let's talk about vitamin B12. Okay, so that's kind of the next one. And again, moms can go get the levels of all of these fixed, and they might find it really makes a big difference. But one of the things that if people are deficient in this, it increases something called homocysteine. Homocysteine is inflammatory. Okay, so it's one of the things. There was a supplement that was popular years ago called SAMI. SAMI actually addressed homocysteine. SAMI's kind of fallen off. I haven't seen very many studies about it recently. And I think partly because it's very expensive, but it's also very fragile. So it could be really damaged in shipping. If it's exposed to a lot of heat, which a lot of times things that are shipped are, and so if it's not handled well, somebody could be paying 60 or $70 for a box of inert, materials. So not very helpful. Okay, so they actually found in one study that with which was by Demon in 2021, they had 217 mothers with postpartum depression and 217 without, and they matched them on age and BMI and some other measures, and they found that B12 was significantly lower in the depressed moms. So again, a pretty straightforward thing. And where I really kind of more drew from is there's a larger literature on this, that actually talks about this in depression in general. You know, not so much, we didn't see so many studies on new mothers, but there's a fair amount actually in the depression literature on this. And again, it's a pretty easy fix, and it's probably a good idea anyway, because you're trying to correct the deficit, a deficiency. So I think actually that's good. So talking to moms about maybe going to their primary care, getting these tested, having them look at this, I think is actually probably a good idea. Mothers may decide they don't necessarily want to do that. They want to take it themselves. Okay. So you can't obviously prescribe that, most of you, but you can talk to them about how this can actually be important. Okay, and why it's probably good to address that deficiency. And again, you know, vitamin D, vitamin B12 are both very easily, obtained, and they're really pretty inexpensive to buy. So I think that that makes it much more accessible. It's like if you sit there and recommend, oh yeah, take this 70 or $80 supplement, that's not going to be enough. That's not going to be absolutely realistic for many moms. Especially if they need to take it on an ongoing basis. But something that costs five, yeah, that's probably more accessible. And actually, if healthcare covers it, they can actually get it that way too. But if not, they can actually probably pick it up. Okay, so that is actually one, but they said that the women with the lowest levels in this study of B12 were 4.53 times more likely to be depressed. So again, that's really big. So it does show you that a pretty simple thing that's easy to fix actually can really kind of put mothers at a much more even kill. Okay, so another one that I thought was actually really interesting is a supplement called Curcumin. Okay, so, a lot of people have heard of turmeric. Well, curcumin is the primary active ingredient in turmeric. It's a curcuminoid, and it blocks oxygen species and inhibitors. Oh, it inhibits COX-2 and COX-1. So it is, um, it's anti free radicals, oxygenation damaging cells, and it is also inhibits those inflammatory enzymes COX-1 and COX-2. Okay, so that's actually what things like ibuprofen do. Those are COX-1 and COX-2 inhibitors. These enzymes, what the problem is, sometimes those are kind of hard on the stomach. There's really no evidence that cumin is, but ibuprofen certainly is, because they're COX-1 and COX-2 inhibitors, partly because COX-1 is the enzyme that actually protects your stomach lining. So you don't want to knock it out. So that's why then they got the newer kind of iteration, which is just only focusing on COX-2. The COX-2 inhibitors like Celebrex. Okay, and so again, they're supposed to be a little easier on the stomach because of that. Okay, but this is something, a kind of natural ingredient that acts very similarly to something like ibuprofen without some of the side effects like the gastrointestinal issues. And those are serious. I mean, those actually cause bleeding deaths in a lot of people. So they're not things to just kind of play around. It's not like, oh yeah, you have an upset stomach. So it's kind of nice to have an alternative to those. Okay, so what they have kind of discovered in the depression literature in general is that people who took supplements of 500 milligrams of curcumin twice a day actually were able to treat major depression, which is pretty interesting. That's a kind of an astounding thing. I was pretty convinced by reading this, but I started taking it myself just because I think anything that's that anti-inflammatory is a good idea. So Fusar Poli et al. In 2020 did a meta-analysis and looking at they found that curcumin lowered depression symptoms in 10 different studies that included 531 patients. It lowered anxiety in 5, which was 284, and it had a large effect size. And if you know anything about research, normally, particularly in behavioral research, you're lucky if you get a small effect size. So a moderate one is really big deal. And this is a large one. So that to me is really pretty convincing from the stats. Okay, and it said, and the other thing that's interesting is if you take this prenatally, it blocks prenatal exposure to BPD for the fetus. So then, quite a good idea. This is something that I think is something that contributes to overall health. Okay, so the last one I want to talk about, and this one I'm a little more iffy about. And so again, I would say let's do this with caution, but mothers may ask you about it. And that is St. John's wort. And I think herbal treatments are, you know, uh, interesting to people because first of all, they can control them. If they don't have health insurance, they're a lot cheaper, and they're not on somebody's record, and that's really significant for a lot of people. If you have certain types of jobs you don't want to have that you have any kind of diagnosis for the things like depression. So that's actually some of the appeal, and I know because I've talked to these moms over the years. I talked to somebody who had some kind of high level defense position, and she just could not have this diagnosis. And the fact that she was, prescribed Zoloft on her sheet, she just couldn't do it. She said that would be job suicide. And even though there's supposed to be, protection of health information and stuff, unfortunately, this stuff does leak. So that is actually one of the appeals. Now, one of the other big appeals is people think, oh, well, if it's natural, it's safe. Well, I think it's important that we have, the required respect for this supplement because it is a medication. Okay, so it comes from a plant called Hypericum perforatum, and St. John's wort is actually kind of its old English name. Okay, so it grows kind of in Great Britain, in northern England and Wales, and places like that. It grows wild, and the leaves, the petals, the flowers are perforated, and it's called St. John's because it blooms right around St. John's Day on the medieval church calendar, which is kind of early June. And wort is the old English word for medicinal plant. Okay, so, the name is kind of funny to our modern ears, but that's what it means. Okay, so, I think it's important that we do treat this as medication because people think, oh yeah, if it's natural, it's safe. And I'd like to point out that lots and lots of things are natural that aren't safe. Lead is natural. Arsenic is natural. There's asbestos is natural. So there's a lot of things that are really quite dangerous. But even, when you're talking about a medicinal plant, it is medicine. Okay. It's medicine that comes in a kind of a different form. So probably safer than a commercial antidepressant, but there's certain things you never want to mix with it. So again, this would be one I would say proceed with caution. Okay, and also too, if you do have a mom who's talking about taking this, have her talk to her healthcare provider because there's plenty of medications that interact with this. And one of the things that it does is it interacts with the liver and with other medications, and suddenly you're only getting half a dose of what other medication you have. So if you're taking, say, cyclosporins because you have a transplanted kidney, all of a sudden you're getting half a dose. Okay, if you're taking birth control, pills, suddenly you're getting half dose. So, been a fair amount of St. John's wort babies, not surprisingly. And so this is something, obviously to be careful. And the other caution, and I can't urge this strongly enough, is if she's taking a regular antidepressant, a commercial antidepressant, do not ever mix this with that because that can cause a hypertensive crisis and death. It's really that serious. Okay, because these are medicines. Most modern medicines had a root in botanical medicines. Okay, so a lot of times they take out the active ingredient, and patent it, market it. Okay, but most of the things that we take for granted as being medicines actually started as plants or plants, are still are plants in many parts of the world. Okay, so let's talk about does this work? Yes, that's the short answer. So there have been a number of studies, and again, there hasn't been as much about this lately. I think, some of it was kind of like there was a lot of interest and then it kind of died off. Okay, but looking at it, comparing it to other types of antidepressants. So there are people with depression are randomly assigned, to either St. John's wort or a medication, and they don't know which one they got. Okay, so that's the design that a lot of studies have used. This is where a randomized controlled trial is a really good idea. Okay, so Le Corbusier in 2002 found that St. John's wort was better than the placebo. And so again, to prove the effectiveness of anything, a lot of times you do want to compare it to a placebo because about 30% of people get better on a placebo. Okay, so it has to be better than that. So yes, they did find that. Okay, another study by Wolk compared St. John's wort with the tricyclic antidepressant imipramine and found it as effective as that. A lot of people don't like the tricyclics anymore, although sometimes people still use them. Uh, they have more side effects, but also too, there's a risk of suicide. If you combine them and take a large dose, you can actually kill yourself. So obviously they have to be very closely monitored. That's one reason why people like the SSRIs. They felt like they were easy enough to kind of prescribe. And they said, I remember reading one thing that was talking about them, and it was saying, so simple, even a primary care physician can prescribe them, which I'm sure the primary care physicians love. But yeah, they are easier and there's less of a risk of suicide and overdose. Okay. So Van Burp also in 2002 looked at 87 patients with major depression. Now, this was kind of interesting because normally you don't use St. John's wort for major depression. You only use it for mild to moderate. Okay. That's the way herbalists use it. Okay, and that's the way it's used all over the world. It is still widely used. It's widely used. It's the most prescribed antidepressant in the world because a lot of places outside the US, herbal medicines never died out. It was sort of flushed out of the US system, kind of back when the American Medical Association, first started growing and becoming a thing. And so a lot of the more traditional medicinal things were kind of taken away. Okay, but like in places like Germany and Austria stuff, it's been used all along. So it is very widely prescribed. Okay, but they used it for major depression, which is not the way you normally use it. This was a primary care practice up in Canada. Okay, so what they did is they had randomly assigned patients to either St. John's wort or sertraline, which is a loft. Okay, and what they discovered is that at 12 weeks, both the groups improved. Okay, so that what you would expect. They're both taking medications. But what was interesting is that there was no difference between the St. John's wort these, and the Zoloft, but that St. John's wort was better tolerated, that patients reported fewer side effects. And so they actually recommended that St. John's wort was a good choice. Okay. And then finally, this meta-analysis by Haller looked at 26 different studies of St. John's wort versus placebo. Okay. And they found a mild to moderate, for mild to moderate depression. And they found a moderate amount of evidence. Okay. So again, it does seem to be effective. Okay. So the standard dosage of this is 300 milligrams 3 times a day. Okay. But some, people I knew, practitioners who work with herbal medicine, say sometimes you have to double that because they're not really responding. So you start with this dose, but you may end up increasing it. Obviously, if you're not a prescriber, I probably wouldn't, I'd stay completely away from that. Okay. But that I'm just telling you so you know. Okay. And that is of a standardized formula that is standardized to 0.3% hypericin or 2 to 4% hyperforin. Okay. So hypericin was really thought to originally be the active ingredient in St. John's wort, but now they're thinking maybe hyperforin. But still, you'll find most brands are actually standardized with the amount of hypericin they have. Okay, so again, like I said, St. John's wort has baffled people because can't figure out why it works. Okay, but they said taken alone, it actually has a good safety record. Right, but the problem is, as I mentioned before, is it mixes with other medications, and there are some concern during pregnancy. And I would say, for a pregnant woman, I would say steer clear. Because why take the risk? Honestly, it might be one of those things that they're hypothesized risk, but why take the chance? Because there's other alternatives. Okay, but it is actually okay for breastfeeding. Kleyer in Austria has done several different studies looking at this in 2002 and 2006 and found that hyperforin does actually transfer to milk, but it is at a very small amount. So the relative infant dose is 1 to 3% of the mother's dose. Okay, so that's actually, very acceptable. Anything under 10% is usually considered compatible with breastfeeding. Okay, but it is very used. Okay, but here is another caution that I have with this. And this is why I don't necessarily recommend, self-medication with this, is the problem is we don't know about the quality. Okay, there's not really an organization here that governs the nutraceutical industry. So a lot of times people can be buying St. John's wort, say, go help store, and you don't know how much you're actually getting. Okay, so to my mind, that's a problem. You may be paying for, a bunch of weeds or a bunch of things that are kind of inert. So if of brothers want to pursue this route, I would actually probably recommend that they go to somebody who's knowledgeable in herbal medicine, like say, for example, a naturopath. That would be a person I would probably send them to if they want to do this. You know, um, if you live in a country where the sources of St. John's wort are reliable, where it's regulated by the government, where you actually know that what you're getting is good quality product, then it is, I think, in that case, safe. But I think even then, that goes through prescribers. So I would say, yeah, there's caution. We do know it does seem to work. Okay. But I want to know that, first of all, what you're getting is actually the actual substance. It's a good quality product. And we don't actually honestly know that here in North America. We just don't. So this is probably one I would, given that there's lots of other alternatives, I probably steer clear of it, but I wanted to mention it. But if mothers do decide to pursue this, I would say, proceed with caution and treat it with the respect that it deserves. It's medicine. You know, natural doesn't mean you can take as much as you want and it will be safe. It's that way with, with anything. Some things, in reasonable doses are medicines, and too much, they're a problem and actually can cause sickness and death. So again, proceed with caution. If you're taking any other medications, talk to your doctor about it. See if they think it's okay. I know a lot of people don't talk to their doctors if they're doing anything kind of natural because they don't want to get trouble. They don't want to get yelled at. For, oh, why are you taking this stupid stuff? It's dumb. But this is one I would definitely recommend doing that. Okay, so with that, I'm going to wrap up. And then the next session, we're going to talk about exercise, which is actually, I think, kind of a really interesting um, treatment. And you think, oh my gosh, is that actually a treatment? Yeah, it actually is. It's quite effective. And see, combined with some of these other things, I think it can be really effective. Okay, so for now, I'm going to end, and I will be back in a bit to talk to you about exercise.